Simply put, it's a lifesaver.
Seriously, it's like curing cancer for these patients.
Talking about bariatric surgery, a range of procedures that are performed on a person's stomach that limit the amount of food they can eat and process. First, the gastric bypass, a real lifestyle change that was started in the 1960s and is still considered the gold standard.
The bypass is certainly much more of a behavior modifier, not only a volume control device, but a behavior modifier. Patients who have a bypass just flat out can't eat junk foods.
Next, the lap band. It's small and it's self-explanatory.
And the more fluid we add to the band, it makes it tighter around the stomach, kind of like a volume control device. And we can actually reduce how much food somebody can eat by putting a band around the stomach. Okay?
It's a really simple solution.
And this is done as an outpatient surgery.
Third is the stomach sleeve.
We very simply just remove 80% of the stomach, the outer part of the stomach, and leave the patient with a new stomach, which is kind of long and tubular, shaped like your sleeve, and which significantly limits how much food they can eat, but also because we're removing a significant amount of stomach tissue, we're taking away some of those hormones that the stomach cells produce that make you feel hungry.
Bariatric surgery really coming to the forefront lately because of a study that involved people with type 2 diabetes.
In fact, the study that was done at the Cleveland Clinic, comparing patients who had the very best medical treatment you could get, working with a diabetologist, a nutritionist, monitoring blood sugars, on a daily basis, the best medications you can get, 50 of those patients versus 50 patients who had bypass surgeries and 50 patients who had sleeves, the patients who had medical therapy didn't even compare in their outcomes. And clearly you had nearly half the patients in the other group whose hemoglobin A1C is normalized. So whether you want to call it a cure or remission, it doesn't matter to them. They're not taking any medication for their diabetes anymore. In addition, those patients who had hypertension and who had sleep apnea, that all went away as well.
It has a fast recovery period, and most insurance companies are covering it now. But you can't just walk in and say, I'm tired of working out, I want bariatric surgery. No, patients have to fit a very specific profile.
You've got to have a body mass index greater than 40, which is roughly about 100 pounds overweight in most people, or a body mass index of 35, 75 pounds overweight, as long as you have diabetes, sleep apnea, or hypertension. So if you have a BMI of 35 with some comorbidities or a BMI of 40, then most insurance companies will cover the operation.
Those that do qualify for the surgery are very pleased with their results, and that makes the doctor very happy.
You have to love hearing from patients who
this
call
is
you up and
the
say,
most rewarding career in the world. It absolutely is.